what is Alzheimer's disease? Although research is ongoing, it is still a relatively poorly understood condition. What we do know is that it is a neurodegenerative disease with symptoms that develop gradually and intensify over time. The early symptoms of Alzheimer's disease can vary person to person, but memory problems are common. Currently, there's no way to distinguish Alzheimer's disease versus other forms of dementia, and its causes are not well known. But research has linked the presence of a gene called APOE to a higher risk of Alzheimer's disease. And researchers are looking into ways to identify Alzheimer's disease using things like brain imaging or markers in blood or cerebrospinal fluid to identify Alzheimer's disease in people with mild cognitive impairment. Now, the disease typically affects people over 65, but there is a rare genetic form of Alzheimer's disease that can affect people as young as 30. Research into what causes Alzheimer's disease and how to identify it is ongoing, and lifestyle factors may play a role in disease development. There is a great deal of interest recently in how metabolic conditions and vascular disease can affect cognitive decline. So how can exercise help? Exercise, especially aerobic exercise, may improve cognitive function in people with or at risk for Alzheimer's disease. When researchers looked at recent studies on the link between physical activity and Alzheimer's disease, they found that aerobic exercise for 30 to 60 minutes, 2 to 5 times a week, had a modest favorable impact on cognitive function, while people who did not exercise showed a cognitive decline over the same period of time. Getting your heart rate up, even in middle age, could lower your risk of developing Alzheimer's disease. One study following 191 Swedish women over 44 years found that cardiovascular fitness could significantly impact dementia risk. In the study, 32% of the women who were in the lower fit group developed dementia, while only 5% of higher fit women did. That means women with a high cardiovascular fitness level were 90% less likely to develop dementia than their lower fit peers. And their common symptoms of dementia, like memory problems, were delayed as much as 11 years. Exercise capacity, age, and smoking status can be predictors of cognitive impairment. A study used the patient records of over 6,000 veterans who had been referred for a treadmill exercise test to look for a dementia or Alzheimer's diagnosis after 10 years. They found that 5.8% of people developed dementia, and that older age at the time of the test, smoking status, and exercise capacity were all predictive of cognitive impairment. However, for every increase in the level of exercise capacity, they saw an 8% decrease in the occurrence of cognitive impairment. The data is still out, but the interesting thing is that some of these studies show that exercise that gets your heart rate up may have the biggest impact for people with mild cognitive impairment who are starting to show symptoms of memory loss. For more information on how your club can accommodate people with Alzheimer's disease or mild cognitive impairment, visit ursa.org.